I know it's one of the conversations that may be difficult to have, but it's prudent to have it. Let's go into it. What are some of these risks that is associated with plastic surgery? We can basically divide it into two. It could be surgical, related to the surgery itself or the type of surgery, or anesthetic. This is if you're going under anesthesia. So when we come to the surgical part of it, we are looking at bleeding and what could cause one to bleed, and how can we mitigate or stop this from happening, or how do we prevent this? Because remember, when you come for a surgery, we don't want you to bleed. We are looking at, first of all, looking at your blood level. We have to make sure that before we go in for any procedure, we have to make sure that you have adequate blood level, and we do this by looking at your hemoglobin level. We also make sure we take a good history. So we need to ask if you're on any medication that could make you bleed easily during the procedure. And this could be some painkillers we call NSAIDs, something like diclofenac could make you bleed easily compared to someone maybe who's not taking that drug. We also have some herbal medication, yes, herbal medication, which could make one bleed easily. We also have some individuals who have some diseases which make one bleed easily. Probably they were born with them or they acquired them in their lifetime. So we really do take time to make sure that we have this. Once we've done this, we then intervene. If your blood level is lower than what we would like, we give you supplements and make sure that we boost that up. Then, of course, during the procedure, we use electrocautery, and that is to make sure that your blood vessels, that we stop them from bleeding. So it is our duty, and again, kindly go to a board certified plastic surgeon. They will make sure that they take care of you during the surgery. The second risk or something that could happen is an infection. This could happen if, for example, your immune system is lowered, one disease or the other, such as diabetes, or if when during the procedure sterility is not maintained. This is in theater or using equipment that are not sterilized. So how do we make sure that you do not get an infection during your procedure? We maintain sterility, we wear gowns that are sterilized, we use instruments that are highly sterilized, and during the procedure we give you IV antibiotics before we start the procedure, during the procedure, and after the procedure. You'll also notice that when you come for wound dressing, that we do it with utmost care to make sure that you do not get an infection after the procedure. Something else that we think about is getting a blood clot. You'll see that during the consultation, we do ask if you have any condition that could make it easy for you to get a blood clot. We also ask if it's a lady, if you're on oral contraceptives or any form of contraceptives, because they do make your blood a little bit thicker than usual. If you're on contraceptives, we do urge you to maybe stop a couple of weeks towards the procedure. We also do some blood tests that confirm how your blood is in terms of thickness, if I could say so, or coagulability. During the procedure itself, we do take measures that are quite serious, or we take them seriously. We do put stockings on you during the procedure, and we have a pump that makes sure that you will not get a blood clot. And post the procedure, we do put you on medication that will take care of you that way. Also, after the procedure, we do urge you to be active. Don't lie around, so that we get you up and moving so that you do not form a blood clot, especially around your calf area. A botched procedure, or maybe something that you did not expect. A botched procedure, how does it look like? When you think of, for example, you came in for a tummy tuck, or you're thinking of getting a tummy tuck. When you think of a botched procedure, or even a facelift, a botched procedure could be lack of symmetry. So for example, one side of the face is not equal to the other side of the face. It could mean excessive scarring. It could mean you did not have your expectations met. So some of these things, number one, you could avoid them by, again, get a board qualified plastic surgeon. Number two, have a proper and thorough discussion with your surgeon, and this is done during your consultation. And in case this does happen, always talk to your surgeon and see how that can be resolved. Coming on to the anesthetic complications or risks, let me call them risks. Remember, for most of the surgical procedures, one will have to go under general anesthesia. When we're talking about general anesthesia, we mean that you will have to go under completely. You will fall asleep. And we do this so that, number one, you have no recollection of the procedure. That's amnesia. We induce amnesia. And number two, you do not feel any pain. So analgesia. So some of the things that we have to make sure is that we get, again, a board qualified anesthesiologist who will take good care of you, and you will also meet this doctor before you have your procedure done. They will need to ask a couple of questions. Number one, are you allergic to anything, any food or any medication? Because most of these medications that they use are highly proteinaceous, and so they want to know if maybe you will have an allergic reaction. They also would like to know if you've had any other procedure done before, because this helps prepare you mentally, because you will come into theater for the first time. There are many machines maybe you've never seen before. There are noises. There are many people in there. It could induce some anxiety. So it's our role to calm you down and give you some comfort. So seeing the anesthesiologist before the procedure is quite important. So when you have this conversation, when they ask you this question, it reduces the anesthetic risk quite well. And if you get someone who knows what they are doing, again, we reduce the risks. Plastic surgery can be life-changing, and it's good. But then again, remember, there are some risks associated with it. And your surgeon should not shy away from discussing these risks with you. And you should also not shy away from asking pertinent questions and getting your fears allayed. And I think when we do this, we can be able to move forward in the right direction and have your procedure done quite well and meet your expectations.